let me introduce you to the science of pharmacogenomics. Pharmacogenomics is a combination of two words, pharma, for pharmaceuticals, and genomics, the study of genes. My story will help illustrate how the power of this science, pharmacogenomics, works. You know, we are all genetically different than anybody else in the world. We all respond to medications genetically different. Here's my story. I take one drug for arthritis. Been taking it for 12 years. My own pharmacogenomics test indicated a severe problem, kidney failures, if I continued to take this particular drug. That was a wow, wake-up call to me, because I could have died or been on kidney dialysis the rest of my life. So, moving on, let me give you a couple of facts. First of all, medical cannabis. There are more people who live in medical cannabis legal states than not. There's a couple of prime reasons that people use medical cannabis. Number one, to lessen the side effects from other medications or from their medical conditions. And number two, to try and wean themselves off of dangerous drugs like opioids, painkillers. The third thing you need to know is that most people taking medical cannabis use 5 or more prescription drugs. Here's where some potential problems can come in. If you're using medical cannabis and pharmaceuticals, prescription drugs, okay, the drugs can interact with each other and cause a dangerous reaction, an adverse reaction, or more unwanted side effects. It's important to know. When you're taking these, you can also create a loss of efficacy for each of the drugs themselves, the pharmaceuticals, as well as medical cannabis. We're all genetically different. Remember that. So, 3 years later, I'm pleased to announce Navigator Genomics, the first in the pharmacogenomic lab industry, has created a test for measuring your individual genetic responses to the key cannabinoids found in medical cannabis and for 448 of the most prescribed prescription drugs taken by the most amount of people. We provide NGT's test, a simple cheek swab done at home. You send back your swabs to our lab, and in about a week you get a report. We ask you to share those reports with your doctors, healthcare professionals, and dispensary so that you can match up, and they can match up for you, the best medications that will work best with you with the least amount of side effects. Visit our website, navigatorgenomics.com.